In this video, we will show how to collect blood sample from a vein, step by step. Gather necessary supplies. Sterile gloves. Tourniquet. Needle or syringe. Blood collection tubes or vial. Adhesive tape or Band-Aid. Preparation. Put on gloves and clean them by hand sanitizer. Ask the patient to extend their arm with the palm facing upward. Apply a tourniquet 3 to 4 inches above the intended puncture site to fill the veins with blood and make them more visible and palpable. Now select the appropriate site and clean the puncture site with alcohol pads. Remember, hold the needle at a 15 to 30 degree angle to the skin, with the bevel facing up. With a quick, controlled motion, insert the needle into the vein. Once the needle is in place, blood should begin to flow into the collection tube or syringe. If using a vacuum collection system, for example, Vacutainer, the tube will automatically fill. Once the blood has been collected, release the tourniquet before removing the needle. Withdraw the needle swiftly and apply pressure to stop any bleeding. Use a clean gauze or cotton ball to apply pressure to the puncture site. Bandage the puncture site once bleeding has stopped. Label the blood sample with the patient's information, date, and time of collection, and send it to the laboratory promptly. Thank you for watching the video. Subscribe my channel.